Welcome. This is Resilience Radio. Who am I? I'm Irvin Eisenberg, owner of Resilience Occupational Therapy and show host on Resilience Radio. The opinions on this show are not necessarily shared by me. I like to feature a variety of different perspectives, and everyone has their own healthcare needs. Additionally, none of this is meant to be medically prescriptive or diagnostic in any way. This episode, we're on again with Grace Johnstone, a doctor of chiropractic and certified hyperbaric and undersea medicine practitioner. She is owner and practitioner at Hardwick Chiropractic and Hyperbaric, Vermont. Last episode we discussed her chiropractic practice, which you can check that out before this. And this episode we'll be talking about her hyperbaric work. Great to have you on again, Grace.
Thank you.
So let's jump right into this. What is hyperbaric and undersea medicine?
Sure thing. Well, hyper means increased and baric means pressure. So hyperbaric refers to the medical use of oxygen at pressures greater than normal, at increased pressure. And, we don't walk around thinking about pressure. We by definition, what you and I are at, and most of us live at here, is normal pressure. So we're not aware of it. That changes a little when you get really up at high altitude, or if you were to go into the depths of the ocean, for example, you would be going to higher pressure. As you go way up in altitude, like when you're in a plane, you're in lower pressure. And that's part of why your feet may swell and you may not feel so great. That's a little stressful to the physiology. So in hyperbaric, you're increasing the oxygen and increasing the pressure. And that has some really unique physiological effects that are, as I said, very unique. Okay,
so you have your practice at Hardwick Chiropractic, and I know you started bringing in these. I'll let you sort of take it from there. What drew you to this work, and what the work entails?
Sure. Well, let's see. In brief, what drew me to this work, again, was my own experience. I got a really severe case of Lyme disease, also had Babesia and Bartonella, some of the co-infections. But in any event, a severe case of Lyme that went into meningitis and then traveled down to my spinal cord and resulted in what's called radiculoneuritis. No one will be tested on any of this, but basically affected my lower limb and the organs in my lower abdomen. And even though this was treated really aggressively with IV antibiotics and basically everything else that could be thought of, I was not recovering. And almost a year later, 9 months later, really was still incapacitated. It just in agonizing pain and unable to walk or dress, daily activities I couldn't participate in. I couldn't read. There was still so much swelling in my cranium that my eyes wouldn't track. So, I hadn't been able to work in almost a year. And just the way it works in Vermont, a friend of a friend heard about my situation. They had a hyperbaric chamber at home because their daughter had almost died from Lyme. She was seizuring constantly, and the hyperbaric is what let her recover. So they heard about my situation and offered to let me use their chamber. And I tried it and could feel that something was happening that was important, that was helpful. And so I managed to get a chamber at home because I couldn't drive, couldn't walk. And actually, my parents had moved in with me to take care of me because I couldn't do it by myself. My father built me a ramp so I could get into the chamber, and I used it every day. And in a couple of weeks, they were actually able to move home. So I wouldn't say I was sprinting around the block yet. It was a regain, but it took some time. But I tell you what, that is what the hyperbaric is what let me recover and resume my practice and all of the outdoor life that I love, and really made me aware of this as a healing modality, and was sort of surprising to me because particularly as a chiropractor, I was surprised that I'd never heard of it before.
Hmm.
And so that spurred me to get certified in hyperbaric medicine. And I determined to bring my chamber down to my office and offer this to other people. And so that's sort of what happened to start the first treatment center here at my office. And really, as within a short time, it became apparent as people heard about it and started treating that we needed to make this available throughout Vermont. That, it's a treatment. It's just like, any medication, you don't just take it once typically, right? But this is something that if you, for example, have a stroke and want to spur the brain to reactivate idling neurons and grow new vasculature into that area, you need to treat with frequency while the brain is doing that. If you have a diabetic wound and you're on the verge of having your foot amputated, well, we want to get you in every day. And that may only take a couple of weeks to heal, or it may be a month or two, depending on other situations. Does the person smoke? There are other health issues, that kind of thing. In any event, it became apparent that we needed to have these available throughout Vermont. And so that's what motivated me to then start a nonprofit called Hyperbaric Vermont, which is hyperbaricvermont.org if you wanted to look at the website. And that mission is around making affordable hyperbaric care available throughout Vermont and the neighboring environs. And so to that light, we offer affordable care. We offer training for other providers who wish to make hyperbaric affordable and available to their own clients or patients. Some of those people are in Vermont. Some of them are out of state. Other docs will fly in and do a training and then do that at home. And we have affiliates who are independent practitioners, but who we've trained and who we help support, who in terms of advice and clinical support, but who offer care to their patients in their offices. And so we have a treatment center in Montpelier and one in South Burlington. And then we have affiliates that include our treatment center here in East Hardwick, but also one in West Lebanon, Grassroots Natural Medicine. There's a treatment center in Brattleboro. There's Blue Skies Hyperbaric in Middlebury. And I'm working on getting some people up in maybe Newport and Rutland area. And then I think we'll have the state actually pretty well covered.
Yeah, that's...
yeah. And so, as I said, we're offering care. So hyperbaric in Vermont averages about $400 an hour if you were to go to a hospital type situation, and very limited availability in terms of what they will treat as well. And that's actually inexpensive. If you were to go to Massachusetts, it's like $1,200 an hour. So they will only treat people who have insurance. Most of the conditions we treat, there's no coverage for. And we are treating for between, $60 and $100 an hour. We have package plans that bring the price down, that kind of thing. And that's less than it costs to provide the treatment. But because we're a nonprofit, we're fundraising or working to fundraise in order to make the difference up so that we can offer this care in a way that people can actually get in and get what they need.
So you've mentioned a few different things that it can help with. It seems like, if I'm understanding this right, and I don't feel like I fully understand this at all, you're putting increased pressure on the body through, you can explain what that is in a moment, and that helps with sort of the body's ability to do tissue growth and fight infections. Is that primarily?
Good inferencing. So let me describe how this happens.
Okay, thank you.
We go in a chamber, which may look like a big igloo, or it may look like a great big tube. Nothing like an MRI. We're talking like 34-inch or 40-inch diameter. You can sit up in it, and that chamber gets pressurized with room air, and the person is breathing concentrated oxygen through their own mask, which means it's somewhere between 93 and 97% oxygen. Now, at normal pressure, we breathe room air, comes into our lungs. That oxygen goes from the lung, which has a lot of oxygen in it, relatively speaking. Air is like 21% oxygen, and loads onto the blood supply and goes through the arteries around your body, and all that oxygen kind of floats off into the tissue. And it gets down to your feet where there's not much oxygen left, and then turns around, comes back through your venous system, back to the lung. We breathe some more, we load it with oxygen, and off it goes around the body, bringing oxygen to all of your tissues. So at normal pressure, the red blood cell is typically between 97 and 100% loaded with oxygen. Okay. So you could breathe 100% oxygen and you might gain 3%. That's about it. Because you can't go over 100%. What changes is when you get into a pressurized chamber, and under pressure, all of the fluid of the body actually becomes oxygen carrying itself. So plasma carries oxygen. The cellular fluid the fluid in your gut, the fluid in your joints, your cerebral spinal fluid, all become oxygen loaded. And that has very, very unique effects that are really powerful. And I can go through that, I'll do a summarized punch list there. But the pressure changes the entire game around how oxygen can mobilize and be carried in your body. And you can bathe tissues that would otherwise be oxygen depleted without using a red blood cell at all. In fact, they've actually done some experiments a couple times. Don't do this at home, right? Where they've taken someone's been in a hyperbaric situation. You can take all the red blood cells out of their body. They're absolutely fine. They don't need them. They're hyperoxygenated without the red blood cell because all of the fluid in the body is carrying oxygen. And, we're almost all fluid, really, when you look at it. So as I said, don't do that at home.
Is there a risk to having of course, my understanding of physiology is when it comes to the circulatory system is fairly basic in some ways, but it seems like you have structures that are, my understanding is the red blood cells are what's meant to be carrying the oxygen. Is there any drawbacks if someone were to be in a situation where, let's say throughout their entire day, they were in a state where all their fluid tissues could hold oxygen? Is there a downside to that?
This is where the difference between high pressure and low pressure hyperbaric come in. Because at high pressure, yes, that could be dangerous. You have to measure the amount of time and exposure that you offer the person or the patient. Because high pressure can create what's called oxygen toxicity. And if you were to Google like risks of hyperbaric, this is what you come up with. Oxygen toxicity, seizures, visual changes. So at high pressure, you have to be careful with that and monitor it. When we're at the pressures that we're working at here, 1.3, 1.5 ATA, we are below the threshold for that. So you actually could be in it all day. And in fact, there are NFL players and basketball players that have their own chambers. If they've been traveling, they'll actually go home and sleep in the chamber overnight. Okay. Now, for most of us, that's not what we're going to do or how we're going to treat patients, but it is, yes, it's actually, you could do that. Yeah.
Okay. And so you're increasing oxygen flow. I can imagine that would help in a number of different conditions. What are the top things that someone should consider seeking out one of these chambers?
Well, could we back up a little bit? Because before I go into the list of conditions, what if we spent a little time talking about what does this do?
Absolutely.
Like, what are the effects? And then we could look at what are the applications, because it will make more sense then. And there are really, 3 or 4 really big ticket items, I would say, that are what a hyperbaric environment does. The first one is that it's a really powerful anti-inflammatory. And it's a systemic anti-inflammatory. Your whole body is in there. So if there's inflammation in the brain, whether it's in the meningeal system or in the brain itself, if there's inflammation in the joints, if there's inflammation in the gut or in your knee for whatever reason, this is a really good anti-inflammatory. We also know that it's a natural antimicrobial and antiviral. And so this is one of the reasons, and there are a number of good reasons. There are a number of reasons why it's good for Lyme. One is it actually kills the Lyme spirochete. So it cannot exist in a high oxygen environment. It's what they call a microanaerobe. That's one of the reasons it's very good at hiding from medication because it can burrow into tissue where there's not much blood supply, avascular tissue, and just hide out. Medications can only be delivered through the blood supply. It hides out until it can tell it's safe, and then it comes out again. So it likes an environment of very low or no oxygen, and it dies when it's exposed to high levels of oxygen, as do a number of other pathogens. But in any event, it's a really good antimicrobial. It's also interesting in that it normalizes immune function. And, we have medications that will boost immune function for people with certain disorders. We have medications that will lower immune function for people who, say, have an autoimmune disease that we use. This actually normalizes both aspects of those things. So if someone is in Lyme is another great example. Lyme actually disables certain parts of the immune system, making them functional, and then also really hyper stimulates other aspects of immune function. So we start to get bizarre allergies and autoimmune issues because of the Lyme. And this actually works to address both ends of that, bringing immune function back into normal. We know that it speeds tissue healing. And also in a slight step aside from how we usually think about tissue healing, because we tend to think of, the liver needs one thing, a broken bone needs one thing, a brain trauma needs a different thing. Actually, all of those relate to oxygen metabolism too. One of the reasons you get a non-healing wound is because you don't have adequate oxygen getting to the wound, whether that's from a huge trauma or from a diabetes situation where the small blood vessels have broken down and you don't get oxygen down to your feet anymore. In any event, this is really good at stimulating healing in all of those tissue types. And so it has applications that are very widespread in that regard. And then really kind of a big picture look, we know that it has a lot of really beneficial, what they call epigenetic effects. So it modifies gene expression. And where we start to have immediate response with the anti-inflammatory and antimicrobial and all of those effects, when they look at long-term hyperbaric, they've now researched over 8,000 genes, and all of them at 30 to 40 treatment hours are down-regulating inflammatory changes and up-regulating anti-inflammatory and what they call trophic changes, or things that spur healing and growth, basically. And so that's where you start to make a really long-term, a lasting kind of change in tissue or in someone's health. Mm-hmm. And they start to actually, they don't test positive for rheumatoid factors anymore. Their Hashimoto's resolves. These things just evolve out as we modify that gene expression over time. So that's sort of more on the forefront of what we're learning in terms of research and all. But there's a lot happening, and there's been a lot happening. There are over 35,000 research studies that support the use of hyperbaric. It's just not something that we do in this country. But we're learning.
What do you attribute that to? What do you feel like the main obstacle for this, if this is as great as you're saying, which I have no reason to believe otherwise at the moment, what's the main obstacle for this being more commonly used?
I think there are a couple. One of them is certainly that in this country, it's primarily pharmaceutical companies that do the research specific to getting something through our FDA. It's very expensive research. You can't just use any research that exists. You have to do specifically for the FDA process. And in this country, that's pharmaceutical companies. They don't have an interest in this. It gets people off drugs. You can't patent it. You don't make money on oxygen. You can't really make money. So it's just not something that they're going to put money into. Most MDs in this country are not trained in hyperbaric. When they are, it's in high pressure systems. I think there are only 5 medical schools in the country that even have hyperbaric chambers. And then those are elective programs. So it's not something that's in mainstream awareness in allopathic care. And there's no impetus to drive that further. You know, I mean, we certainly don't have the money to do research for the FDA. So that research is largely, there is some happening in this country, and I could give you some links to some of that, but a lot of it is happening internationally. And internationally, you know, other countries' FDAs have approved hyperbaric for between 80 and 100 and something different conditions. Whereas our FDA, you know, we have 14 conditions.
What are those 14? Do you know them?
Oh, I
offhand,
could
or?
give you that list. I don't have them memorized, but some
Okay.
of them are things like gas gangrene, radiation necrosis, which is actually something that we do see. We do see patients for that. There's a whole, I can get you that
Yeah,
information.
I can put that in the show notes.
Sure thing. Yeah.
For people. So as far as I mean, I don't have anything particular going on with me, but I'm sure I've got some inflammatory condition stuff, as many people do. What would be a cue that maybe I should check out personally? Using one of these.
Sure. Well, you know, for one, for example, infection that you developed, or anything that is really feeling like it's a little struggle for your system to accommodate, to recover from, would certainly be a good spur. Certainly Lyme or any of these infections that can be really tenacious and can go into hiding and emerge and look like any of a host of other things, you know. But really, as a wellness care thing, you know, when you look at really what we think of as normal aging, all of those things, whether it's, you know, mild cognitive changes or short-term memory loss or stiffness or slower recovery time from athletic endeavors or other accumulated traumas, all of those things are some expression of inflammatory process, low-grade chronic inflammatory process. That's what we think of, you know, that's what normal aging is, right? It's really an accumulation of those as we go through life. And so addressing that as we go really changes one's ability to be vibrant and expressive and healthy in life, and boosts resilience. You know, it increases our neuroplasticity. It boosts resilience on the part of our entire system, immune and otherwise. Yeah.
So how does this how there's the undersea component, which I assume this is referring to the fact that if you go underwater, you have more and more pressure the further you go down. Scuba divers, are they naturally getting some of this? And what's the depth in water that's the equivalent of this?
So your question raises a number of different, issues. So I'll do my best to track through that. It's called hyperbaric and undersea medicine in part because, particularly in this country, hyperbaric evolved from an undersea and military type of experience. Those, you know, high altitude and undersea military expeditions and those kinds of things were where this came from as a need, a medical need. You know, scuba and all that is relatively new as an entertainment, you know, as a sport, if you will.
Mm-hmm.
But it evolved from a military perspective. And that's part of why, particularly here, we've thought of hyperbaric as a high pressure situation, because undersea, when you come up too fast, you've heard of the bends.
Mm-hmm.
That happens when you come up too fast and you go from a high pressure situation to a lower one. Nitrogen actually comes out of solution and creates bubbles in your bloodstream, and that can create all kinds of lung and stroke and, you know, other issues. And so the treatment for that is to get in a hyperbaric situation and pressurize back to that pressure where that nitrogen came out. That's where you need a high pressure hyperbaric system. For most of our stuff, we don't. In fact, it's much less stressful for the central nervous system to be in a mild or low pressure situation. But in any event, that's why the hyperbaric and undersea perspective, and that's why you know, the original structure or framework in that within those parameters around thinking that we needed high pressure. Let's see, what else did I? That was a long question, Irvin.
So I guess the other part of that was the pressurizing that's taking place and the typical low pressure treatment. Do you have a sense of what the equivalent in water depth that would be?
So that's more like 1.5, 1.3, like 10 to 12 feet, something like that.
Mm-hmm.
Yeah. And at that pressure, you're loading plasma. You're loading cerebral spinal, you're loading all that. You don't have to go to the depths of the ocean. Yeah. And likewise, as you go higher, when you get above 7,000 feet, then you start to have, that's why most of us flatlanders, as you say, even here in Vermont, we get up in the peaks, and at 7,000 or 8,000 feet, we're breathing pretty hard just to walk around, because we're at lower pressures and less oxygen in whatever we're breathing in the air.
Okay. So I'm just sort of imagining some people thinking, well, how can I do this myself without the chamber? I'll just dive off the dock a lot and get down to 10 feet, try to touch the bottom of the lake kind of thing. Would you see any health benefit to doing such a thing?
Well, the trick would be, how do you breathe high levels of oxygen down there?
Fair enough. I guess you're not breathing in, so you're
right.
It's
Short
not the pressure alone.
Gills. Right. And that's part of why adding the extra oxygen helps. There's certainly a clinical effect in a chamber without concentrated oxygen. Just breathing room air, you still have a clinical effect, but you can maximize it by using an oxygen concentrator and breathing, about 95% oxygen while you're in there. You maximize dose. So you can really manifest a very good dose for all of the tissue. And, that has immediate effects, but it also has really powerful effects over time. Yeah.
And are there conditions where that sort of not that this would be an all-inclusive list, where people should really not be seeking this?
Sure. Let's see. Well, certainly anything where they should be in the ER instead, right? So meaning, and I have to say, one of the really along those lines, the one thing that we screen from in terms of trauma, or you don't want to go in if you have an undiagnosed collapsed lung. So if you have some risk of that, and there are condition signs, symptoms that demonstrate that typically, then you should go to the ER or go to the MD first. If the collapsed lung has been treated, meaning there's a shunt, then you can treat in a hyperbaric chamber and be absolutely safe. So other than that, really, there are a handful, maybe 3 medications that are also on our website, and I can give you for the notes if you like. There are 3 or 4 medications that would preclude using a hyperbaric chamber while you're on them. Most of them are chemo meds. Not all chemo meds. Some are just fine, but there are a handful that we would wait to between treatment rounds or wait until after treatment. The hyperbaric tends to increase the effectiveness of any medications that one is on. And so there are some chemo meds where this is actually helpful, and you can do hyperbaric and actually lower your dose or get a much more effective treatment without causing damage to the tissue, which is one of the issues with chemo. Likewise, radiation, it increases the effectiveness of radiation treatment. So we tend to, some oncologists are aware of that and comfortable working with it. Most of them want us to work in between those radiation series. Hyperbaric is the only treatment actually that spurs radiation damaged tissue to recover. There's no medication that does that. Whether it's soft tissue or osteonecrosis where the bone is degenerating and dying post-radiation. Sometimes that relates to the pericardium. There's pericardial damage when women are treated with radiation for breast cancer. Oftentimes it's an oral throat kind of cancer. But this is the one treatment that actually can help someone recover from that. So there's some very good uses, as we learn more about it and educate other physicians about it. But in terms of risks, particularly if you're not at high pressure and don't have to worry about oxygen toxicity, it's very, very, very safe.
So how would someone go about seeking out use of the hyperbaric chamber? What's the process there?
Some people are referred by their MD or chiropractor, or naturopath, or other, acupuncturist. Some people are referred and come in from that route. Some people discover us online by themselves, or a family member is researching, alternative treatments to dementia, for example. And so they hear about us. And then our procedure is that we do what's called an intake kind of procedure with one of our doctors, which would involve reviewing health history, looking at medications, answering any questions that the patient would have or that their family member may have, writing a prescription for the use of the chamber and the oxygen concentrator, because those are both regulated by the FDA and require a physician's prescription, and then recommending a treatment plan and having an initial treatment with the patient so that we can work through any issues they may have around their comfort level in the chamber, or ear pain, or any of the other kind of things that we want to make sure that we can accommodate for and that the patient is comfortable. And then it's a matter of coming in and doing the treatment at whatever the recommended frequency is for their particular condition or conditions, and for their health climate, if you will. For people who are dealing with something and have a lot of other, they may be diabetic, or maybe they smoke, or they have congestive heart failure, that may slow some of the process in treating another condition. But the good thing is that those conditions would also be improved upon by the treatment. So this is interesting because, when you combine something that's an anti-inflammatory, speeds tissue healing, a natural antimicrobial, and an immune system normalizer, you throw a pretty wide net. That helps with congestive heart failure. It helps with gut inflammation. It helps with fatigue. So whatever they're treating for, it's going to have a lot of side benefits as well. And so coming in as a patient is really that simple. One can refer themselves. One can be referred by another doc. Either way, they're going to go through our intake and screening process, because our docs are trained in hyperbaric, and we want to make sure that the patient has what they need in terms of good care. And then there's an ongoing kind of evaluation as they're in treatment, so that we can assess their progress rather, and change whatever needs to change, keep their questions answered, that kind of thing. Yeah.
So the first step for people would probably be to check out the website and see and look into the intake process.
Yes, so that's hyperbaricvermont.org, and that would have our contact information about treatment, the intake forms, the price ranges for the different package plans and for individual treatments. It even has the list of medications that are a problem for hyperbaric. So a lot of questions could be answered there. Yes.
Wow, this is such a amazing offering you've made available for Vermonters. And I'm curious to see how receptive people will be to it, whether or not we'll be hearing a lot more about this in the next 5 years or so.
Yeah, well, it's come a long way in the last 5 years. I started a nonprofit in 2017, and we're getting referrals now from MDs, from oncologists, from pulmonologists, from people who are dealing with Crohn's disease. Their gastroenterologists are referring to us. People who work with people with diabetes, that's another, puts one at risk for both non-healing wounds, but also retinal damage. So more and more, we are long COVID. I mean, my gosh, we're seeing a lot of patients for long COVID. Kind of some similar things go on there as with Lyme and, chronic Lyme and chronic fatigue and fibromyalgia, those kinds of autoimmune and immune dysregulation and neural dysregulation. This is very good for addressing those things.
Yeah, it seems like, are you getting rheumatology referrals at all?
Mm-hmm. Yes, we are. Yep. We just got a patient with PMR, polymyalgia rheumatica. So the word is getting out. We just want to keep getting it there. This is one of the things that can help with conditions, a lot of conditions for which there are just no other great answers. if you have a non-healing wound and they've done everything they can do to help it, there's not a whole lot left. Or chronic Lyme or long COVID. There's no magical drug there. Brain injuries, stroke, cognitive impairment. So yes, it's important for people to know about this.
Well, thank you for spreading the word and making it available and sharing with us today.
Well, thank you for helping me with that, Irvin. I appreciate it.
I hope you enjoyed listening to Resilience Radio this week. Thank you to Aaron Marcus for providing music for this show with their tune Some Biological Process. You can check the show notes for full credits on that. And thank you for listening. If you enjoyed the show, you can share it with a friend or subscribe and get a new episode every week. You've been listening to Resilience Radio. Take care.